you. Welcome to the regular meeting of the Public Health and Safety Committee for August 21st, 2024. My name is Jason Chavez, and I am the chair of this committee. Before we begin the meeting, I want to offer a friendly reminder to all members, staff, and the public that these meetings are broadcast live to enable greater public participation. These broadcasts include real-time captioning as a further method to increase the accessibility of our proceedings to the community. Therefore, all speakers need to be mindful of the rate of their speech so that our captioners can fully capture and transcribe all comments for the broadcast. We ask that all speakers moderate the speed and clarity of their comments. I'll also note that the Board of Estimate and Taxation has a meeting in this room after us, so we will need to conclude by 3:30 p.m. to allow time for transition. At this time, I'll ask the clerk to call the roll so we can verify the presence of a meeting.
Councilmember Payne.
Present.
Rainville.
Present.
Ellison is absent. Palmisano.
Present.
Vice Chair Wansley.
Present.
Chair Chavez.
Present.
We have 5 members present.
Let the record reflect that we have a quorum. I also want to start us off by singing Vice Chair Wansley a happy birthday. So we're going to do this because it is her birthday today. And I am sorry for embarrassing you. And Council President Payne is going to lead us this time. Happy birthday to you. Happy birthday to you. Cha cha cha. Happy birthday, dear
Councilmember Wansley.
Happy birthday to you.
Are you going to do the black version? No Stevie Wonder version? Okay. All right.
Happy birthday to ya. Happy birthday to ya. Happy birthday. All right, let's get started.
Thank you.
Okay, with that, the agenda for today's meeting is before us. There are 8 items on today's consent agenda. Item number 1 is amending a council action to increase revenue in the amount of $28,000 for the school-based clinics program. Item number 2 is amending a joint powers agreement with the Minnesota Bureau of Criminal Apprehension for human trafficking investigations crime analyst support. Item number 3 is authorizing a contract with Hennepin Technical College for continuing education of 2 peace officer candidates. Item number 4 is authorizing a state grant-funded contract with Hennepin Technical College for training of future peace officers. Item number 5 is authorizing a memorandum of understanding with the United States Capitol Police for reimbursement for participation in the 2025 Presidential Inauguration Task Force. Item number 6 is approving Carolyn for council appointment to the Community Commission on Police Oversight for a 3-year term beginning June 1st, 2024 and ending May 31st, 2027. Item number 7 is setting a public hearing for September 11th, 2024 to consider an ordinance amending Title 12, Chapter 244 of the Minneapolis Code of Ordinances relating to Housing Maintenance Code, amending temporary housing provisions to establish provisions mandating regular reporting included but not limited to outcomes for individuals experiencing homelessness related to encampment removals delegated by any ordinances or other city policies related to homeless encampment removals. Item number 8 is setting a public hearing for September 11th, 2024 to consider the mayor's nomination of Rachel to the appointed position of Emergency Management Director for a term ending in January 2026. Are there any discussions on these items, or would anyone like to pull an item out for discussion?
Yep.
I'll pass it first to Vice Chair Wansley.
Thank you, Chair.
Then Councilmember Rainville, then President Payne.
Okay. Thank you, Chair Chavez. I do have questions related to items 3 and 4. If we have staff here, they're from MPD to speak.
If we have staff that can come ask questions, we can also pull them out for discussion.
Yeah,
so
sure.
we'll just pull out 2 and 3 for discussion. I'll ask.
Sorry, 3, 4.
3 and 4. Okay. And then I'll ask maybe Councilmember Payne, Council President Payne, and Councilmember Rainville might want to pull something out too. Councilmember Rainville.
Thank you, Chair. I would like to pull item number 7 out, please.
Perfect. 7. And then I'll ask Council President Payne.
Thank you, Chair Chavez. I'm not going to pull this item, but I just had a question around item number 2 for the joint powers agreement associated with the Bureau of Criminal Apprehension around human trafficking. Can I ask staff questions on that, or do you want to pull that for a different
I
discussion?
feel like because there's a lot of items being pulled out, it would be probably best to just have discussion on those items, ask questions, and then we'll move forward. So what I'll do in this instance is we'll pull out item number 2, item number 3, item number 4, and item number 7 for discussion, and then I'll move approval of items 1 through 8, except, as I noted earlier, 2, 3, 4, and 7 that will be moved for discussion. All right. Seeing no discussion on the consent component of these items, I'll move approval of those items. All those in favor say aye. Aye. Those opposed say nay. Great. Okay, let's go on to item number 2, which is a joint powers agreement with the Minnesota Bureau of Criminal Apprehension for Human Trafficking Investigations, Crime Analyst Support. For that item, I'll just ask staff to come up, and Council President Payne, I'll hand it to you for questions.
Thank you, Chair Chavez. I was curious, just in terms of the scope of this, is this also going to be inclusive of labor trafficking?
Speaker might be a little, if you can get closer.
Chair Chavez?
There we go.
Council President Payne? I actually am not sure of the answer of that. I know it supports a crime analyst, a full-time crime analyst, and then there's another contract that supports overtime for an investigator. But I don't know the scope of the work. I could defer. We don't have that answer with us today.
Okay. Maybe for the clerks, could we note that as a follow-up? Thank you.
Thank you so much. Does anybody else have any questions on item number 2? All right. Next up, we'll go on to item number 3, which is authorizing a contract with Hennepin Technical College for continuing education of 2 peace officer candidates. I'll pass it on to Vice Chair Wantry, which I believe you pulled it out.
Thank you, Chair Chavez. I just wanted to make sure I understood at least this contract component correctly. So the 2 candidates that's been selected to go through the training with Hennepin Tech, will they be certainly joining MPD after they're done? I just wasn't fully clear if they would be obligated or are guaranteed to be officers here once they complete that training.
Chair Chavez, Councilmember Wansley, the contract for the $99,000, which is the 2 officers, that is a cohort of multiple agencies that they'll be joining, not with the MPD cohort, but they do have to complete and get certified. They're not committed to being required to join MPD, but they are required to get the certification.
Okay, so they could join a different law enforcement agency if they decided to after being done.
Chair Chavez, Councilmember Wansley, that is correct.
Okay, thank you. And then Chair Chavez, can I move to my question relating item 4?
So we'll go on to item number 4, which is also pulled out, which is authorizing a state grant-funded contract with Hennepin Technical College for training of future peace officers. You may proceed, Vice Chair Wansley.
Thank you, Chair Chavez. So in regards to this item, I actually authored a legislative directive to learn more about what the city is doing to improve hiring practices amongst its public safety workers. This really came forward after we had the situation where Officer Timberlake was hired last year, and there was concerns around MPD's hiring practices and making sure that we're hiring officers that meet high standards. When I received a response on that LD a few weeks ago, at that point, the staff could not share information from whether or not MPD had put any guardrails or made any corrective actions around its HR practices to make sure that situations like that doesn't happen again, and actually advised me to directly contact MPD around this. So that said, could you share what changes have been implemented to help, the council and the public feel confident that, we're not continuing a practice of hiring problematic officers?
Chair Chavez, Councilmember Wansley, I cannot speak to changes in the hiring practices in MPD. I can only speak to how this grant is administered.
Absolutely, and I believe we do have a number of staff. I even see our leader here with Gator. So if someone from MPD could join, or even I see we have a commissioner as well.
If someone from the Office of Community Safety, the Minneapolis Police Department, could just come up and answer some few questions, that would be appreciated. Welcome. Thank you.
Thank you. And Chair and Councilmember Wansley, just to kind of set a foundation for it, the practices that were in place before the inquiry took place and some time ago were reviewed by the chief himself, and we were found that those practices were not meeting the expectations from the community and were not meeting the expectations of the chief and the police department. Therefore, it was reviewed. Just in short, there were practices in place where the review of certain processes in terms of the hiring processes were not as meeting the expectations of compliance for making certain that we were getting individuals who were of high character and individuals who were what the community expected to have. So signing off processes and other reviews, just as the chief did with certain use of force issues where you would typically have a first rung supervisor who would come in and review a use of force, and then what he did was institute a secondary piece to that and having a lieutenant, which was the next level up. So we're two supervisors reviewing. Same process in play went in with the hiring process. So you would have, say, an investigator conducting the initial investigation, then you would have a supervisor reviewing that investigation and signing off on it. Then you have another supervisor and another going all the way up through the deputy chiefs within our department reviewing that. So that in itself would assist with making certain that once a person is onboarded on the police department, that it's been reviewed several times, and any thing that would take place that would allow any certain mistakes or overlooking of information would not be present currently on the police department. And those have been put in place since then, along with the compliance with the new laws with the post board, with the hiring practices and reviewing background packets when individuals come into the police department, and that goes for all individuals or all agencies throughout the state of Minnesota with the post board.
Thank you, Assistant Chief Gators. Can you share also, I'm assuming this is codified as well in terms of internal policy that lays out that chain of command that you just shared?
Yes, we have a practice or a procedure with that, and it's laid out, and I believe that, I don't know if it's been sent to your office yet or not. That's something that we can look at, making certain that you're truly aware of. But yeah, there are practices in place that are drastically different from what was taking place a few years back.
Thank you. And then I will also mark that for the clerks too, if we could get a follow-up. I don't think I received it yet. Would love to get my hands on that. So if we can note receiving from MPD, would that be like your policy, the change policy on hiring practices?
It would be the practices of hiring and kind of a chronological order of what is done now, and then it can be compared to what was taking place back then.
Were you able to capture? Okay. Thank you, clerks. Thank you so much, Gator. Thanks.
Thank you.
That's all I had.
Thank you, Vice Chair Wansley. And then next we have Councilmember Rainville, who pulled up item number 7, which is the establishment of provisions mandating regular reporting included but not limited to outcomes for individuals experiencing homelessness related to encampment removals delegated by any ordinance or other city policies relating to homeless encampments removals. Councilmember Rainville.
Thank you. So I'm just wondering, will that ordinance be available to review, or when will the ordinance be reviewed, number one? And will that include the effect on the immediate communities and things like sex trafficking and addiction?
Thank you for the question, Councilmember Rainville. So if you pull up the agenda for today, under this item, you will find an RCA. You will also find in that item, if you click the links, the ordinance that is published for the public to view. So it's on today's agenda already, and the public hearing is for September 11th for the public to know. Now, in regards to public safety issues, part of this ordinance is requiring reports on 311 and 911 calls. So that's going to be up to the police department to report on how they wish, but we added that into the ordinance.
Great, thank you very much.
Yep, thank you. And then, let me see if anybody else is on queue. Nobody else is, so I'll just finish a few comments for the public. That item number 7 is the encampment eviction reporting ordinance, which is requiring reports from the administration on the cost of encampment evictions, the impact of encampment evictions, and the outcomes. As we head into a budget deficit in the city of Minneapolis, it's important to know how our taxpayer dollars are being used. For example, when you are dumping rubble in East Phillips and Midtown Phillips, when you're using staff resources to dump concrete in Phillips in an area that is predominantly people of color and immigrant, it is important to the people of Minneapolis to understand how much these resources are costing, what is the impact of it, and maybe beg the question is, if we're heading into a deficit, maybe we can be more effective with our taxpayer dollars and actually use money to fund housing and put people into a place they can be supported in. So that's item number 7. I also want to make a comment on item number 2 that Council President Payne pulled out for discussion. We know that around 20 to 25% of construction workers in Minneapolis are paid cash or off the books. We also know that many of these workers are undocumented residents who are being mistreated by construction companies and being abused and taken advantage of. So my hope is that when it comes to the contract, which is contract number 2, that it is also about labor trafficking. When many of our residents are being taken advantage of by these corporations, construction companies, I actually got to visit a location where it was non-union and it was predominantly people of color and immigrants who were being paid below minimum wage. And then I went to a construction site where it was union and people were being paid triple the amount than that undocumented worker in that site. And it was just inhumane, it was wrong, it was disgusting, and it's just something I can't stand for. And I hope that that contract with human trafficking, we could figure out ways to also, address labor trafficking in the city of Minneapolis, which is predominantly taking advantage of people of color and immigrants in our city. So I'm thankful for the work that is happening, but I also hope that there's ways to, address human labor trafficking in that as well. So I'm going to check the queue. I'll pass it on to Councilmember Palmisano.
Thank you, Mr. Chair. Just in regards to your comments on item number 2, I appreciate you lifting up all of those affected by labor trafficking. But I did want to point out that wage theft is most often handled by our Civil Rights Department, not our Police Department. And the partners that we work with at the state are DOLI, the Department of Labor and Industry. So I'm not sure what the Minnesota Bureau of Criminal Apprehension would really be doing. They're not taking fingerprints, they're not gathering evidence, that sort of thing. It seems odd to me that the labor trafficking would go, trafficking is trafficking. They take similar paths. I've learned a lot about trafficking in my 10 years here on the council, but to me, these two issues seem rather separate, and I just wanted to point out that I know we have strong partners at the state from the Department of Labor and Industry in terms of the labor issues. So thank you.
Yep, thank you, Councilmember Palmisano. I don't see anybody else on queue, and my point is there is a lot we have to do when it comes to labor trafficking. There are many people in the city being taken advantage of, and whether it's figuring out this particular contract or anything else, we need to do a lot to address the issues that are impacting many of our residents. I don't see anybody else on queue, so colleagues, with that, I will move approval of item 2, 3, 4, and 7. And we can do a roll call, we can do a roll call.
Councilmember Payne.
Aye.
Rainville.
Aye.
Ellison is absent. Palmisano.
Aye.
Vice Chair Wansley.
Aye.
Chair Chavez.
Aye.
We have 5 ayes and 0 nays.
That item is approved, and the entire agenda that was on consent is approved as well and will be moved to full council. With that, members, we will move on to the 2 remaining discussion items. Our first discussion item is receiving and filing a report on the Minneapolis Health Department opioid response in relation to the Opioid Settlement Fund Strategic Plan. I'll invite our Commissioner of Health to introduce that item, and then I believe you also have Deputy Commissioner Ritchie here as well. And welcome, Commissioner Damone Chaplin.
All right. Between the last time I was here, I must have forgotten. It's just black screen. Oh, that's, is this you? Yep.
Good afternoon, Chair Chavez.
Welcome.
Council members. My name is Damone Chaplin, Health Commissioner, Minneapolis Health Department. We're glad to be here today. We're going to give a brief update on the Opioid Settlement Fund Strategic Plan. I know folks have been waiting for this for a while. We're pretty close to where we'd like to be. We're probably 75 to 80% done with this, but we can give you an update of where we're at right now. And so today I will be joined by Deputy Commissioner Heidi Ritchie. We'll be going through a background and process overview of the strategic plan, previous recommendations, and current priorities, along with the review of goals and strategies, and then some initial action steps that we'll be looking to take forward over the next year or so. So, next slide. And so, as many of you may know, in 2021, there was a nationwide settlement where we reached to resolve all opioid litigations against pharmaceutical distributors, totaling about $56 billion. The state of Minnesota was awarded upwards of about $500 million, of which 75% will be distributed to counties and municipalities to support local response efforts. The city of Minneapolis is set to receive about $18 million over the next 18 years and in regular installments of approximately about $800 to $1 million per year. The mayor's 2025 budget appropriated about $899,000 to the Health Department for fiscal year 25. The Health Department will provide the City Council with a detailed spending plan in the fall of 2024. Opioid settlement funding can be used in a variety of different ways to support prevention, treatment, and recovery, as outlined in the Minnesota Memorandum of Understanding, Memorandum of Agreement. The Health Department elected to develop a strategic plan to inform the use of these funds. The process ensured that the individuals with lived experiences, residents, community, and government partners, and the relevant city departments had the opportunity to provide input. Next slide. And so, what we see here is the state and county priorities as it relates to grants in Minneapolis. You'll see Hennepin County has, over 2024, 2025, has invested somewhere in the range of about $8 million in Minneapolis towards the opioid epidemic. And the state, likewise, for fiscal 24, has invested about $5 million. Next slide, please. And so this slide, you'll see a table below that will show a summary of those expenses. The reason that I'm showing this is so that you can see what's highlighted there is recovery is the area that's probably having the least amount of investment. And so you'll see that show up again in the presentation as we go a little further. Next slide. And so the process overview, in January, we started this process. We developed a strategic planning committee, which included both mostly internal internal department agencies. That committee met roughly about 4 or 5 times over the last 6 or 7 months. The consultant also was doing community interviews and surveys during that period of time, and so that information was brought together, and the Strategic Planning Committee had a chance to review that information and then provide some guidance and recommendations. Next slide. And so here you will see a summary of the stakeholder engagement framework, which will include a community survey, which we received about 250 responses, and then focus groups with individuals with lived experience, and then interview with focus groups with providers and partners, and then also interviews and comments with government partners and advisory groups. Next slide. And so we will leave this to Deputy Commissioner Ritchie.
Welcome, Deputy Commissioner.
Thank you very much. Good afternoon, Chair Chavez, Vice Chair Wansley, and members of the committee. Heidi Ritchie, Deputy Commissioner of Health. I'll be talking a little bit about the multi-jurisdictional task force on opioids that was initiated in 2018 by the mayor in order to enter into this space. Prior to that, we did not have an opioid response. So the task force brought together a number of people, both internal and external, and governmental entities, community organizations, and the idea was to figure out where the gaps were, and that's where we wanted to enter into the space as a city. There were 4 subcommittees that came out of that work: the Prevention Subcommittee, the Treatment, Recovery, and Peer Support Subcommittee, the Community Systems Integration, and the Child Protection and Criminal Justice Subcommittees. They each provided recommendations. Some of them overlap a little bit, and that has been the basis of our work up until this plan is coming, up until the finalization of the plan. So for the Prevention Subcommittee and the Treatment and Recovery Peer Support, some of the things that we've done on a high level, if you want more details, I'm happy to follow up later with some details of the program that might be interesting to you. We've funded and implemented programming in the areas of culturally specific prevention, harm reduction, treatment, recovery, and peer support. We've modeled our first step hospital-based intervention program after the next step hospital-based intervention program that was started in the Office of Violence Prevention, now the Neighborhood Safety Department. This also includes peer navigators and an accompaniment in the hotel. So people either come in as a point of entry with an overdose, or they can show up in the emergency department and request an accompaniment, which is a person that would basically be with them while they're going through whatever they are with this service, whether it be medical induction or other type of wraparound services. They have someone with them. We've also increased our MOUD, or medications for opioid use disorder. In the presentation, you'll see MOUD and MAT. They're used interchangeably. MAT is medication-assisted treatment. We've increased access for that through community clinics, street medicine, and education of clinician cohorts through the First Step hospital-based initiative. We funded community partners with peer recovery models that provide services specifically to BIPOC communities with a focus on East African, Native American, and Latino. We've initiated the Stop the Bleed and Narcan administration, so Train the Trainer, to youth in and around the city with a focus of North Minneapolis. And then we've provided Narcan education and distribution at community meetings, schools, churches, sports facilities, and via community and elected official request. We also work with the tribes to provide culturally inclusive treatment and recovery, including traditional ceremonies, intergenerational connections, advocacy, on-site MOUD, and wraparound services. Next slide. The next 2 committees, the Community Systems Integration, really kind of worked to pull together some of the different systems that work on substance use and try to get them on the same page a little bit. That's also a work in progress. We do that every day. We have increased our hospital workforce capacity through the Medication First model, which is technical assistance to clinicians to initiate MOUD in the ED. We have seen a gap where clinicians don't necessarily feel trained and comfortable to prescribe MOUD, and so we're working with clinicians to get them training and get them to where they need to feel comfortable prescribing. We work with the county and the high-intensity drug trafficking areas to put out communication in the event where we see spikes in overdoses or new variants in the drug supply, like xylazine. We've modeled our First Step program, I've mentioned before, after the Next Step hospital-based initiative. We work with Hennepin County and our IGR team to support some of the pieces that we don't have authority in these recommendations. So a lot of the things that have to do with child welfare are more in the purview of Hennepin County. That said, we still work with them to support the policies that they think should be moved. So for example, last year we worked to help them assure that every jail in the country in Minnesota is offering MOUD for the duration of their stay. Assure that prisoners, both state and federal, in Minnesota are offering MOUD for the entire duration of someone's stay, as dictated by the patient's decision-making with their provider, so not the prison making that decision. And then also working on reimbursable peer recovery services for people under the age of 18. We also developed culturally specific outreach materials for educating pregnant mothers about treatment options and the importance of seeking medical care throughout their pregnancy. And then developed BERT policies that help protect the mother and family if they're working on a plan with a doctor to avoid removal of the child at birth. Next slide. So those are a few of the efforts that we've been working on for the past 4 or so years while we've been using the recommendations from the Mayor's Multi-Jurisdictional Task Force as a guide. So with some of our opioid spending, we've got some previous efforts that we've done up until now. So providing, this is also general fund, so there is some general fund, some opioid settlement in here. Providing a network of syringe disposal units to support syringe litter mitigation in impacted areas, which includes cleanup, and working with Public Works to maintain and install syringe disposal units or syringe drop boxes. Contracting with community partners to provide ongoing education on the administration and distribution of naloxone among the communities most impacted by the epidemic. Implementing a hospital-based MOUD pilot, which you've heard me reference a number of times in First Step. It's a low-barrier, high-volume settings like emergency departments where we implement this, and it's to connect individuals with treatment and community resources following an overdose. We've also expanded to include people who want to get help. They can come into the ED in the hospitals we're working with, and they don't have to necessarily have an overdose at that moment. Establishing ongoing relationships with community partners to develop a concerted strategy. So just really working together to make sure that we're not sort of all working in our different silos, but we're coming together to maximize our resources in the region and in Minneapolis. Contracting with community partners to implement prevention programs with communities impacted by this epidemic. We just entered into a contract with Russell Herder for an education and outreach campaign targeted to youth, specifically in our impacted communities. I mentioned before, Native, Black, and Latino are those communities that are most impacted. And then collaborating with internal and external partners to expand access to MOUD and other treatment options. So there's a number of things we're doing. The mobile medical unit is one of those. Also working with some of our First Step partners to try and get that medical induction. And then the necessary services once someone has been inducted into MOUD, they need some follow-up afterwards to make sure everything's going okay, they've got the right dosage, those types of things. So just really making sure we're following. Some of our current priorities. So we've outlined some of our strategies previously, and some of the other key items that we're looking at is, I mentioned the mobile medical unit. Mobile medical unit is one that we hope will help meet people where they are. One of the things is that we have a lot of resources out there, but they're not being accessed at the rate that they could be. And so we want to make sure we're meeting people where they are. We're providing as much low barrier access to medical care, including wound care, MOUD follow-up, dental care, all the types of things that you might need. We're also hoping that this can be deployed around encampments to help with the needs that we see in some of the encampments around health. The mobile shower and restroom unit, that one we had a bid out for, and then the bid doubled, and so we had to go back and revisit whether or not that's a spending priority that we want to continue with. Some other options might be contracting out that service instead of buying the unit ourselves. So we're still working on that one. Narcan vending machines, as many of you hopefully know, we put in a Narcan vending machine with our amazing partners in the fire department in Fire Station 21. That has been heavily utilized, and so we are pleased that it's being utilized. And we are already talking with Hennepin County and the fire department for a Narcan vending machine on the north side. And that would be, we would buy the machine, and Hennepin County would be responsible for filling it. We are also looking at a site over northeast and another site over south. So these have been really utilized and popular, and we like the fire stations because if there is an active overdose or emergency, there's medical personnel there that can also respond. And then we're able to more easily monitor and fill and access the machine. Safe recovery site research. I've talked with several of you about this before. So we got a grant from the state of Minnesota in partnership with St. Paul Ramsey Public Health to look at sort of national and international environment around safe recovery sites, or safe use sites is another word, that is another term used for them. And then what the legal landscape is, the feasibility in our community, so kind of coming from a large lens down to a more micro lens. And then part of this grant is also engaging with the community and to see where communities might be ready, where they might need more education, and where, a space like this might be feasible for the city of Minneapolis. So that is something that we have been talking with St. Paul Ramsey about. We're going to do an RFP coming out in the next, hopefully, month for that work. And then the first step expansion, which I've already mentioned a number of times. One of the larger contracts that we had, it was almost $1 million contract, so I want to go into it a little bit more here. That's Helix Health and Housing Services. So the contract began in December 1st, 2023. The first part of the contract was in response to the Ninakasi encampment over in South Minneapolis. So Helix provides innovative and comprehensive public health response to addiction and homelessness for individuals who have historically not been successful in mainstream housing programs and models, and to unsheltered folks. The population that they proposed to serve was and is majority Native American. Phase 1 of the contract, like I mentioned, was to provide housing and human services to residents at Camp Ninakasi, and then Phase 2 was setting up a culturally inclusive substance use disorder treatment program. It was expected that the project would be completed between December 1st, 2023 and November 30th, 2024. We have all the invoices we need from them. We're just waiting. It's going through the process for the last little bit, and then we'll be closing out the contract. Their goals was to assist the city to develop an innovative and effective public health response for homeless encampments and to address the unique circumstances of community within encampments and the tendency of people to move in groups together. They address inequities by conducting targeted outreach to Black, Indigenous, and people of color, improve public safety for South Minneapolis residents by reducing the number of individuals residing in homeless encampments. Their objectives were to house and provide continuous case management for individuals exiting Camp Ninakasi, hire a team of professionals to provide wraparound services for participants, utilize City Minneapolis startup funding to rapidly develop a Medicaid billable encampment response program, track outcomes and report successes and challenges to the City of Minneapolis for an analysis. This program is undergoing a review right now, as many of you know, and so we're just reviewing all of the documentation that they provided us. That should be completed in a month, I think. So the way that it worked is once in housing, community-based services are provided on site for easy access and connection, or delivered in the community if the individual becomes unsheltered again. In addition to wraparound services, staff are on site to address immediate needs and safety concerns. The frequency of staff engagement is tailored to each individual. Some individuals require more contact with staff and others need a lighter touch. The long-term goal, which is around 9 to 12 months, is permanent supportive housing in the community and continuance of established services for ongoing recovery from addiction, housing and economic stability, with the goals of living substance-free and permanently housed. The services they offer, which are on the screen, on-site substance use treatment, including all forms of MOUD, housing case management, mental health case management, diagnostic assessments and therapy, community health worker services, public health nursing, SBIRT, culturally specific outpatient substance use and treatment. So this contract, after approval at this committee, Public Health and Safety, on November 8th, received full council approval and signature from the mayor on November 16th. By November 22nd, Helix had moved 2 people into permanent housing and transported 1 to treatment. Next slide. Some of the outcomes. So I broke this up into the 2 phases. So we've got the housing and the treatment. For the unsheltered housing and health support. They provided initial housing for 94 folks. In addition, 25 came from outreach workers and encampment connections that Helix had. To date, they had 17 people lose their housing, which include 9 who abandoned the unit and did not return, 6 who were evicted from housing due to lease violations, and 2 to jail. A few of these individuals have since resurfaced, and Helix is working to rehouse them again and connect them to appropriate services. 74 plus 25, so 99 individuals are engaged in services at some level. They've had no overdoses or deaths, and 25 people have been rehoused since January. Next slide. For phase 2 of substance use disorder, that one just got underway. So far, I'll get to outcomes, but they are a Native American specific in-home treatment model. They're abstinence-based. On-site services provided include treatment, community-based services, and housing services. Treatment services include mental health psychotherapy with group and individuals, mental health targeted case management, substance use disorder groups and individual therapy, and community health workers. Some of the optional community-based services include recovery fitness, Wellbriety, Men's Smudge Support Group, Indian Center Drum Group, the Indian Center Fitness Class, biweekly Sweat Lodge, quarterly overnight events such as volunteering to help elders put together naming lodges. Housing services, clients have leases, they accrue rental history among admission. The housing readiness curriculum is offered, and once clients complete the curriculum, they begin the housing search. For treatment, we have a male facility and a female facility. The male facility has so far had 13 admitted, 7 have been referred to another program, 3 have graduated, 3 have been approved for housing. The female facility opened August 12th, so just about 10 days ago or so. There's 7 Native women, 1 is pregnant, and so those are the basic outcomes for the 10 days that they've been open. They have identified some undiagnosed mental health issues and disabilities that have led to chronic homelessness in these individuals. Some may require group homes because their level of need is higher. And women, some of the special circumstances with the treatment with women, I mentioned they have a pregnant woman there. They also have women that they're trying to reunify with their families, so they do have space for visitations. And so most of the folks that are housed they have their own space, so it's not like a congregate setting. Next slide. So after that, I'm going to turn it over to Commissioner Chaplin for the rest of the presentation.
Thank you. Welcome, Commissioner.
Thank you. Thank you, Deputy Commissioner Rechi. So the final goals and strategies, after the meetings with the Planning Committee and then also the surveys and interviews, we came up, the consultant had come up with these 4 goals over the next 3 to 5 years. Obviously, as I mentioned before with the previous slide, recovery being an area of where we could use more investment, so enhance prevention and recovery support. Goal B, or the second goal, would be support access to evidence-based, culturally specific treatment, and then also improving coordination and alignment between governments. And so this has come up several times in many, many meetings, asking for there be deeper coordination, collaboration between city, county, and state on this particular issue. We do not get the bulk of funding when it comes to responding to this issue, but we can leverage that funding to work more deeply with our intergovernmental partners. And so that came out as one of the strategic options for this particular plan. In addition to that, ongoing opportunities for community engagement. And so how do we include the community in this process as an integral partner in this process as decisions get made and resources get evaluated? Next slide. And so you'll see here, we've expanded this chart just to show some of the examples of evidence-based practices. We will work with the mayor's office to determine what those specific strategies will be going forward, and then we'll present to you guys that specific arrangement of services sometime in the fall. I think in October we have scheduled for presentation to the City Council. Next slide. And then also we've expanded not just the evidence-based practices, but also some of the key indicators that will go along with some of those programs as they get developed, and we decide on which programs will be used. And so you'll see those indicators kind of explored, and so you can track how the progress of those particular programs will be going over the course of the next several years. Next slide. And so the last part here, again, this intergovernmental coordination, and then the bottom piece here is the city acting as a convener. When you do a collective impact model, you have to have a backbone organization. Initially, we're going to ask the health department to be that backbone organization to get us moving forward. We are currently scheduling meetings with the county and the state for the fall that will extend over into the spring and then also into the summer of next year. And so this will be a continual work that we'll be doing with them to kind of develop ideas, cover gaps. A lot of times, even now, as we have begun speaking about this strategic planning process, we've identified areas where we're both spending a lot of resources in the same area and not getting the results that we want. So we have an opportunity to kind of talk about that and evaluate that deeper going forward. Next slide. And so there are a couple of strategies that were not included in this particular plan. There are specific reasons why. The harm reduction and naloxone purchase, this is not impacting the current investment we're having with the Narcan vending machines. But the city chose not to prioritize the purchase of naloxone and safe use supplies for two primary reasons. One, Hennepin County made several large investments in harm reduction programs located in Minneapolis. Secondly, the state is actively working to create a centralized process for purchase and distribution of naloxone, and the city is a part of that process conversation. And then the safe use sites, as Deputy Commissioner Ritchie just mentioned, we actually have a grant with the state to kind of evaluate that process going forward. So those two items were not part of this actual plan, but they will be worked on going forward. Next slide. And so the initial action steps that we'll be taking over the next year or so will be establishing regular meetings and cadences between the Health Department, Hennepin County, response team, the state of Minnesota Opioid Epidemic Advisory Council, and the state of Minnesota Office of Addiction and Recovery Services. We will be establishing a regular cadence of provider and partner update meetings, which again, there's a complex system here, and so trying to untangle that system and really bring partners together to talk about how we can provide more efficient services. And then establishing a plan and process for ongoing community engagement. As we mentioned before, how do we really include those with lived experiences and the community members in this process as we develop solutions. And then lastly, establishing a funding strategy for designated programs and services. How do we take the funding that we have as one pot, both city, county, and state? How can we use this funding together collectively to kind of work on the issues that are most important to us in the city? And that will end our presentation. We're open for questions.
Thank you so much, Commissioner, and thank you, Deputy Commissioner Ritchie, for the thorough presentation. I'll look at the queue. We first have President Payne.
Thank you, Chair Chavez. Thank you, Commissioner, and especially thank you, Deputy Commissioner Ritchie. I feel like we started this work my first year in office back in 2022, and you've just been a really good partner in helping build not just my personal understanding, but I feel like our collective understanding of the opioid crisis in the city. And you've had, great experts like Dr. D come in and do presentations. And I think a lot of my questions are going to start with acknowledging that this problem is so much bigger than what we have the capacity to take on as a city. And so obviously we're going to be working with experts that are outside of the city. We're going to be contracting with service providers. And so I'm trying to make a distinction between some of the great work that our professional city staff are doing and the uncertainty of what it means to contract in this space around some of society's most complex challenges. And I want to ground us as this is one of society's most complex challenges that we're dealing with. And so that's just a preface for a question, and we have a number of folks in the room here, so I'll just get straight into it. We have this Helix contract, and I just pulled it up and read through the RCA again, and on paper, I'm reminded why I emphatically supported that contract, because on paper, it's ticking off every single box of the strategy that you've outlined here, and it sounds like exactly what we need: culturally specific recovery, intensive case management, everything that we would want to see. That's on paper. But then there's what's happening on the ground, right? And our question on city council is how do we make sure that what we're committing to on paper is actually getting delivered in the real world? And when there's a gap, what are our processes to make sure that we're looking into those gaps and closing those gaps? And so my first question is, for that Helix contract, did we go through the standard city procurement process that any other vendor offering any other type of service of a similar scope would go through, or did we do a different procurement process to develop that contract?
Welcome, Deputy Commissioner.
Thank you, Chair Chavez, Council President Payne. Thank you for the question. We followed the process of a sole source contract for this particular contract.
And are the policies around that clearly like documented, something I could go back and kind of check and make sure that we did follow it by that policy, or is that something that is a little bit organic and in flux as far as policies in the city?
Council President Payne, through the chair, there is an established policy and there is a form and process you have to go through. It has to be approved by finance in order to enter into a sole source contract.
And that would be strictly a CFO decision, or would that be would that rise to the level of the mayor in that instance?
Council President Payne, through the chair, I don't know if that's a CFO. It might be on the level of the deputy CFO, but I can get that information for you.
And then, as far as the contract language, I don't know that I've actually seen the contract language. I've mostly just read through what we have on the LIMS file. Did we have in that contract evaluation criteria that they had to meet and checkpoints for that evaluation criteria as far as like recognizing invoices and so on?
Council President Payne, through the chair, yes, absolutely. And I am happy to send you that contract and the exhibits that show the scope of work, the budget, the staffing model that they were proposing, as well as the evaluation metrics that they worked on with our evaluation team. We do have a quarterly one report that I believe I have shared out. I can again. We're waiting on the quarter two report because they are going through a review of their documentation with our audit department, so that one isn't ready yet. But we have monthly invoices from them, monthly reports, and they have provided all of the documentation requested by the audit department.
And I'm familiar with the fact that it's going through an audit process. I sit on the audit committee, so I've been tracking this. And without getting into too many details, was there a moment in our standard process that flagged concerns that maybe even predated my awareness of this going into this audit process, or was it more so some of the community concerns from the outside that flagged those concerns?
Council President Payne, through the chair, the latter, it was, there was an anonymous letter sent, I believe, to the city council, and that resulted in actually a request by Helix for an audit, and then city leadership went to the auditor and said, would you review this documentation? So I don't believe it's an actual quote-unquote audit. At this point, they're reviewing the documentation.
Okay, so the core of the question is, do you feel that we had an appropriate set of controls in place to capture or flag issues as they arise, or do you think that we need to look at our policies around this and make sure that those controls are stronger so that we don't have to wait until letters come to council members' inboxes to discover some of these things?
Council President Payne, through the chair, I think that's a broader question around our contracting process. For this particular one, I didn't feel any hesitation as documentation was coming in. As I had conversations, I went on a site visit to one of the treatment facilities, and I had no concerns.
And do you know how many sites there are? Because my loose understanding is that they're housing folks kind of in a scattered site strategy, but I'm actually not entirely sure of what their model is.
Council President Payne, through the chair, that is correct for the housing portion of it. They work with landlords, and they work with landlords on leases, so they are a scattered site. The majority are like in their own unit, as I mentioned before. And then with the treatment facilities, they own the two buildings, but that's owned by it's a different model. It's a little bit more nuanced, and I can follow up more with that, but they do own those 2 buildings.
And I'm wondering, how
Homes.
restrictive were we in our scoping of the contract around their model? Is it something that we were prescribing to them, or is that something that they had articulated in the contract, or was that scattered site approach something that was kind of developed as they started getting people housed?
Council President Payne, through the chair, that was how they did things before they came to us. So that was sort of their business model. Then the proposal was specific for the Camp Nanocasi. So they just kind of folded those both together.
And then, were there any provisions in the contract language that specified how they were supposed to either interact or notify immediate neighbors to where they were doing some of this housing, or was it did that not come up in part of the conversation?
Council President Payne, through the chair, I'm not aware of any such notification requirement, but I can look into it and ask further.
Okay. Thank you. Those
You're
are
welcome.
most of my questions.
And if the clerks can note the last question, which was about, if you can repeat your questions to the clerk, and then I'll pass it on to Vice Chair Wansley.
If there were any provisions specified in the contract or any discussion about requirements of to notify neighbors of that model happening in those properties.
Thank you. Okay, Vice Chair Wansley.
Thank you, Chair Chavez. First, thank you so much, Public Health Leadership, for this presentation. I think everyone knows that opioid response is a high priority, not only for our residents, I know for my office as well. And it's one of the reasons why I authored a legislative directive to ensure that the council and the public could receive updates on what the city is doing to be responsive to our worsening opioid crisis and the outcomes of those efforts. So thank you for spending, several months in developing this very comprehensive presentation. I do have a couple of questions. First, starting out just with actually I'll just go in order. On slide 2, it's outlined that the state was awarded $500 million, 75%. Yep. Yep, there we go. 75% of which was going to counties and cities, and that ended up being about $400 million. Yet Minneapolis only received $18 million, which is about 4% of that total. And given that we are the largest city in the state, it does sound like the amount, or it seems like the amount should have been higher. If we add, the city's $18 million to the Hennepin counties and state of Minnesota grants that was taking place and outlined on slide 4 and 5, that would total to about $31 million in settlement funding program that we could have had. So I'm just interested in knowing, do you know why we received so little of this funding? Was there a formula? Yes. How did we land here?
Councilwoman Wansley, through Chair Chavez. I wasn't here for the formulation of the distribution of funds. States do it differently, and so I do not have an answer for why. I do not have an answer for why it was distributed that way.
Okay. Deputy.
Hello again. Councilmember Wansley, through the chair. So I have a disbursement schedule I can show you, but this $500 million, which 75% would go to the counties and municipalities. So that includes, like, Hennepin County got $80 million on top of, or Hennepin County got $80 million, and then all of the other counties in the entire state needed a piece of that pie, and then some of the other cities needed a piece of the pie. So really, when we get down to it, the $500 million was carved up, and we got $18 million of it. So that's how the negotiations went with the state. And we did have former Commissioner Gretchen Musicant participating in the negotiations on the state level. And actually, she's credited very highly with getting the 75% that we were able to get for cities and counties.
That's great to hear. Just, it sounds like, though, geography was not really taken into account. And I think we have this conversation even around local government aid with us being the largest city and recognizing the scope of need and how that translates to funding. So thank you for providing that context. I'm also very interested in learning a little bit more about the hospital-based First Step program that was referenced. You highlight the fact that, definitely saw the similarities right out the back to our Next Step program, and really great to hear that it was modeled after that. We even just had a couple national providers who, actually, the organization that created the hospital-based program, Next Step, Javi, come and talk about the metrics of success that model has yielded, and really wanted to hear if you can share any key metrics of success for the First Step program, such as percentage of individuals who are able to enter treatment after receiving that intervention point, or the health outcomes for individuals who participate in the program relative to people struggling with opioid use disorder who do not participate. So wanted to see if there was any of those figures around or information.
Councilmember Wansley, through the chair. I've got my opioid response manager here. I'm not sure we have the data off the top, but that's definitely something we can follow up with. We have been talking with our partners at mHealth Fairview about this thing, the data and what we want to capture, and some of the challenges that we've had with getting data from the state, and then also just the privacy concerns around medical data. But we can definitely get you some data to show sort of what we've done over the last couple of years with First Step. I just don't have it with me today.
Awesome. I will note for the clerks then a follow-up question. I can send this to you more specifically, but yes, follow-up information around the First Step program. Additionally, so we actually recently received a presentation. This is related to, slide, let me double check. Slide, we're going to 16 and 17, where we dig a bit into some of the goals. So as I was mentioning, we had a presentation from the Office of Performance Management and Innovation on Monday that was talking about the rollout of evaluation of our programs across all of our departments. So I was excited to see this list because they said departments were really doing the legwork to shape their indicators of success for different initiatives. But I did want to get clarity on, if these were just examples, and if you go to slide 16, it says indicator examples. If those were just, again, indicators that you might use, or if these are the indicators that you will be using to measure or track success and progress.
Councilwoman Wansley through Chair Chavez, these are examples. We will need to work with PMI to kind of codify what those indicators will be once we work with the mayor's office to identify specific programs. So these are just examples of indicators that could be used for similar types of programs.
Okay, and that brings me to my next question. So, public health, y'all are familiar with doing comprehensive plans like the Climate Equity Plan, which is like our 10-year blueprint of how we're going to become a more resilient city, climate-wise, and making sure equity is centered in that. It did say on the last slide that you all are intending to formalize a plan. Do you intend to move something similar that focuses on opioid response, where it will have the similar, these goals, strategies, metrics of success, also delineation of who is holding that work? Because I can imagine, as it's shown in this presentation, a number of departments touch this work. It's not just you all alone, and moving that through the council process like we did with the Climate Equity Plan.
Councilwoman Wansley through Chair Chavez, that's it. That's the goal.
Okay.
The goal is to build this out over time so that we can be very specific about how programs will be supported.
And so moving it is similar to the Climate Equity Plan.
Correct.
And then bringing it through council for adoption. Do you have a timeline on when we can expect that? It seemed kind of open-ended in the presentation.
Right now, the next step for us is to give a presentation to council on October 8th on the work we'll be doing with the mayor's office.
Okay.
That's the next step.
And from that's where you all will talk about the plan then?
We'll have a more completed plan, and we'll have a more
awesome.
We'll have a more completed plan.
Awesome. And then this is probably a question that Deputy Commissioner can respond to. So you did flag for the mobile medical units and expanding that to encampments. It seems like that wasn't fully established yet, and wanted to get a sense of, do you know when there will be a determination made around whether or not that will happen?
Councilmember Wansley, through the chair, actually, that is definitely going to be the case.
Okay.
Yeah.
Okay, great. And then I will move on to slide 13, also regarding Helix. I just want to say, Council President Payne, you asked a lot of the questions that I wanted to cover around the contract. But one piece of it that I did want to reference on slide 13 is it talks about the 99 individuals and basically, gives that as a touch point. But I wanted to know if staff, in your follow-up evaluation, if you had any opportunity to acquire qualitative data directly, like speaking to the participants yourselves, amongst any of the 99 folks who did participate in their program.
Councilmember Wansley, through the chair, I have not personally spoken with any participants on my site visit. We were in the women's treatment facility before it actually opened, and we spoke with a couple of the providers, so mental health and social workers there. But I have not personally spoke with any of the participants.
And this is since the contract was awarded, because I think you mentioned the site visit happened while you all were early in the process, or you did site visits throughout the contract?
Councilmember Wansley, through the chair, the last site visit we did with the treatment facility was a month ago, maybe a month ago, maybe less. So it was very recent.
And you split the presentation into both the treatment side and the housing. Did you get a chance to do site visits on the housing side?
Councilmember Wansley, through the chair, I didn't personally do any site visits on the housing side. We were working with Helix and our communications to try and get like a personal impact story. But one thing that we understand is that these are very vulnerable folks. They feel a lot of shame, and to have someone like me come in and start asking them questions, it's very intimidating. And so we have been trying to figure out a way to sort of showcase some of these personal impact stories in a respectful way, and also in a way that folks are comfortable coming forward and doing that. Right now, we haven't had much luck with people being comfortable and wanting to come forward and have those conversations on camera.
And this is regarding the housing, though you said you haven't done any site visits, but this is for other staff who might, it sounds like, try to do site visits at the housing site and found that residents weren't receptive?
Councilmember Wansley, through the chair, it was through our work with the communications department, so our communications manager, working with Helix and with some of their case managers to try and find people that would come and do a personal impact stories with us so that we could get that out into the community and promote some of the good work that they've been doing. But again, it's been hard to find someone who feels comfortable right now with doing that. They're still in it's only been a few months for them, and so they're still in a very precarious position, many of them.
And have you gotten a chance to do touch bases with our homeless response team? I know Councilmember Chavez and I were out at sites like Camp Ninakoski, where I know a number of residents were recruited from there to go into Helix services. And there was reference that our own cities encampment response team were also connecting with them, and that they do sometimes gather that qualitative data. Do you know if there was any touch point between public health and our homeless response team around that?
Councilmember Wansley, through the chair, we have regular contact with the homeless response team. We had a meeting with them today, as a matter of fact, to just kind of go over the different encampments we have. And, it's very rare that we have something to offer because a lot of the work we do is preventative. Opioid response is one of the areas where we're a little bit more on the response side than the preventative side, which is not super normal for public health, but definitely something that we enter into when we need to. But yes, we do have touch points with the homeless response team. And we were out there, both myself and Suzanne Young from, who is our opioid response manager, during the closure. So we were on the ground witnessing the transport and the referrals, and there were a lot of organizations on the ground, and we were trying to connect all of them so that we had a good sort of idea of how people were being moved out of there. But as you can imagine, that it is chaotic, so sometimes, when those events are occurring, it's hard to get like an accurate count. But by the end of the day, we were getting numbers from Helix like on a almost hourly basis.
Okay, and I just wanted to go back in terms of referencing the qualitative data piece, because I do know when I was out there, especially looking at this number of 9 abandoned the unit and did not return, or folks who maybe were provided services and decided not to partake. I know I actually encountered some of those folks at the encampments who decided to move back to the encampment because of their horrible experience in Helix. So I wasn't sure if that was captured at all by maybe someone on the ground, like you mentioned, our homeless response team, which from my understanding were out at the encampments regularly, and maybe they were able to pick up some of that qualitative data, but it sounds like that has not come up. Going back to the contract, a question that Council President raised, this is expiring in November, correct, or in December?
Councilmember Wansley, through the chair, it expires at the end of November, but we expect that the PO will be closed because we're currently processing their last invoice, and then the PO will be closed once those are expended.
And do you know whether or not if Public Health will be considering, Council President raised this, a competitive bid to see if we could solicit additional services, or continuing the sole service contracts, bid contract with Helix?
Councilmember Wansley, through the chair, so I'm going to try to answer that not knowing what we're actually going to be putting into the $899,000 proposal between now and when we present in October. There are no plans right now. We're not in discussions with Helix to extend the contract or to add any money into that. So right now, we're just really focusing on what this plan is telling us, and then going from there and making sure that our recommendations to you in October and the work that we do with the mayor between now and then reflect what we saw and what we heard from community in the plan.
Thank you for that. And the reason why I'm mentioning the competitive bid process, because based off of this presentation, it seems like the Helix contract was relatively and extremely successful at getting close to 100 people off the streets and into permanent supportive housing. And we know from county data alone that in Minneapolis, the number of chronically unhoused residents is about under 1,000 people. And just thinking, if we were able to fund interventions at this scale, we could essentially have like Texas level results and solve the crisis of homelessness in our city. So it would be good to try to diversify the number of organizations with credible histories of doing this work, to have some of the similar results and get hopefully some really good outcomes. So we just wanted to see if we were exploring the competitive process. Thank you for answering the questions. I have one last comment, and this is more so was already addressed again when Council President Payne raised some of the concerns around a letter that council members received. I do want to acknowledge, my office has also heard a lot of concerns from residents and service providers about this particular contract. And I know Councilmember Chavez and myself as the leadership of this committee have really done everything that we can to address those concerns and do so in a serious manner. One of that was doing this presentation to really hear about what are we doing to show up seriously for opioid responses, and also how are we evaluating the contracts that we enter into with service providers that are claiming to do this work and do so meaningfully. And I think it was already mentioned by Deputy Commissioner, but in regards to letters that were, provided to council members, anytime letters that have concerns around allegations, there is a formal process that happens. You mentioned the audit process that was solicited, and I do want to highlight our city auditor's office has been a really great resource in supporting us as we try to navigate some of those concerns, and hopefully we'll hear something from that office in the coming, I don't know the time frame of how long these type of processes go, but hopefully the city auditor will play a really good role in helping us get more clarity about what's going on here. But it sounds like there are things that you all are taking into consideration around guardrails, evaluations of contractors as we move forward in enacting this plan that's still under development around how we show up for our residents struggling with opioid use disorders and mental health disorders and so many other different crises that they're experiencing. So thank you again for this presentation, and thank you to community members for showing up today and staying on us to make sure that we're doing our or taking our oversight abilities very serious. So thank you to our residents as well.
Thank you, and thank you, Commissioner and Deputy Commissioner, for the comprehensive presentation. If we can go to page 11, regarding the Narcan machines, the vending machines. First of all, I want to thank you all for the work that you all are doing to, establish that site, the first one here in Minneapolis. It's a really good thing. It's a really positive thing for many of our residents. The question I have is, if we're thinking about expansion of these sites or work with Metro Transit, one of the things that Council President Payne and I did is directed our policy and research team. They're going to come back with a report early next year on what other municipalities are doing with this, but I think there's an ability to partner with Metro Transit and talk about expanding these sites next to a light rail, maybe next to transit stations where we see a lot of overdoses, where many of our residents are dying from this epidemic. So my question is if we've thought about potentially expanding some of these sites to transit stations or transit hubs where we see, many of our residents overdosing and, being impacted.
Yes, Chair Chavez, thank you for the question. We received so much interest from communities outside of Minneapolis when this vending machine went in. So I think that's really great that we've gotten people from the state, people from other counties, people from other cities around the nation, just really trying to understand like how we did it and what, where we put it and what the feasibility is, how much it costs. One thing that we were intentional about in this particular vending, the first one that we went in, is that we wanted to make it as low barrier as possible. There is a control where there's a bit of time before you can take out another box, so it's not like you can stand there and empty out the machine in a quick amount of time. But we are going through it very quickly, and so there's a cost associated with that we have to figure out in an ongoing way. And so working with Metro Transit, I think, is our next step after working with Hennepin County. And I know that I'm hearing from the community, I'm hearing from many people about, how good of an idea it would be to put in the Metro Transit stations. I agree with that. We just have to figure out, what would be the role for each of us, for Metro Transit, for the health, who would take the cost, that type of thing, because it can be expensive. The actual machine is only about $20,000. There might be some infrastructure that has to go in, like we had to put a concrete pad and some electrical work at the fire station, but it is relatively inexpensive for the equipment, but the ongoing cost is the kicker.
Thank you. And those costs and those numbers are good for us to understand as council when we think about budget priorities and things we really care about, which this is really good, effective. It does not even seem expensive, to be honest, and could save many lives. The other question I have regarding this is if we've thought about expanding these vending machines and possibly including like fentanyl testing strips, as those can save many lives, and I think that could be an option too.
Chair Chavez, fentanyl testing strips, also xylazine testing strips. Yes, those are some of the things that we've talked about including. But at this point, we wanted to just go with the Narcan and, and see where we are after, a year. And, if we need to make adjustments. That also goes with the security of the machine. Right now, we haven't had any problems. But there are measures we can take if we need to, like adding a code or like a zip code or things like that. But again, when we first put this out, we wanted to make it as low barrier as possible. We knew that might have some concerns around, safety or people emptying the machine, but we wanted to see where we were at and then make adjustments if we needed to.
Thank you. And then can you repeat, and thank you for that update, really appreciate it. Can you repeat the component about, because I'm trying to remember what you said, it was the mobile showers, so it's in pause, or we're figuring out if this is something we want to pursue. Can you explain that a little bit further?
Sure, Chair Chavez, thank you for the question. Yes, it's on pause because at first what we thought is, well, we're going to just buy the unit ourselves, and then we have more control over its placement and things like that. But it's a pretty long process, which we kind of found out through the mobile medical unit, which we are buying ourselves. It's a long process. There's a lot involved. There's other things like the truck and pulling it and other expenses, and sort of things have added up. And so the bid that we had before has pretty much doubled. And so we have to reevaluate whether or not that is a good amount of money to spend, or if we maybe look at a different route, which would be something we've done in the past. We've contracted out for hygiene service areas. We did that with the Wall of Forgotten Natives, where we contracted out and we had our partners provide those services and we funded them.
Thank you. And maybe if our clerks can note this, because I don't know if you're going to know the numbers, but it would be good to know what the increase is now, since it doubled, how much that is. As you know, the city council is exploring our humane encampment response policy, which is these showers aren't in alignment with what we want to do when it comes to establishing an ordinance for an encampment response policy. So I personally do think it would be effective and smart to purchase these mobile showers and figure out how we can do that. And my question would be if we can get the actual cost of it and how much maybe the department has to purchase these sites and what that gap is as council goes into deliberations about the budget. So I don't expect you to answer the cost right now, but I'll just note it for our clerks if we can figure out like a report back to council of what the cost is, how much did it double by, and what budget are we talking about as we head into November, December.
Yeah, thank you.
And then I have a few more. Thank you so much for including information about the mayor's 2018 opioid task force. I think having an update on that is really important. I guess my question would be is, one, it's a very long list of priorities. It has, I believe, what was it when I saw it? It has recommendations and then action steps. Do you know the percentage of how far we are of accomplishing the recommendations and action steps in the plan?
Chair Chavez, I do not have that information. I can probably get that for you, but I'm not sure. It's just the way that these recommendations are, and I'll just tell you a little bit about the decision that they made to include all of the priorities from each subcommittee. Initially, the 4 subcommittees, after they did their work, were going to get together and then prioritize like a couple recommendations. When we all got together, they said, we don't want to pit one priority or one committee's priorities against another. And so we literally just said, we're taking all of the priorities and we're putting them on here. Even the ones that we don't really have authority over, like the dashboard on child welfare. And so, like, it's a little tricky to come up with, like, a concrete number. And there are, like, some of these programs that we have, like the Next Step program, will hit a number of these, maybe not perfectly, but they do hit them. But I can try and come up, I mean, let's talk and see like what you're looking for.
Yeah.
And then we can come up with a metric that will
Perfect.
give you what you need.
Thank you. And it doesn't have to be necessarily a percentage, but it's more of like, I actually look at this recommendation list a lot just to see like how things are going. Maybe one example could be similar to what Director Amanda Harrington did for the Safe and Thriving Communities report, and just talks about like in progress, complete, engage. So that might be helpful just to know where things are at, because I believe council is very interested about a lot of this work, and would be a lot of folks probably want to figure out like maybe there's a budget issue that I want to address in November, and I want to figure out how we can address this and help staff. So it's more of like a what do we need to do, and then how can we be supportive. So that might be a good blueprint. But yeah, thank you.
Thank you.
And then my last question would be about the engagement of you're going to come back to council about how we're going to use these dollars particularly. I know there's going to be conversations with the mayor's administration. I personally, as my advice, would be engaging council before then, right? Like what does council want to see in terms of like what their residents need? There's many of our wards, I'll talk about Phillips and Ward 6 and 9 in particular, that are very, very much struggling with the opioid crisis. And I think my office and councilman office can give insight of what many of our residents are experiencing, what they want to see get done when it comes to tackling this opioid crisis. So I guess my only recommendation to staff would be to engage council prior to that meeting of like, what do our residents need? Because I think it would be better for everyone if we actually can work together on this plan rather than just reacting and then, that's a little different than collaborating. But I appreciate that you all are going to come back to council to present this. I think that's a good step. And I think it would be good to even have engagement prior to that so we can work together on this.
Understood.
And that was my last question. So, Councilmember Rainville is on the queue.
Thank you, Chair. And thank you for this great detailed report. I can see there's been a lot of thought put into this, so it's great information. It's also clear that we need to scale up how we help people. You do have some success with 99 encounters, and you have the right approach, which is to bring in our state and county partners. And you had mentioned stepping up the candidates as when you meet. I think that's a really good term. But when you say step it up to weekly. This is a crisis, and they're going to be somewhat resistance because this is a bureaucratic turf battle that you're in now. We have the people in our area that have the need, but there's also responsibility from the county and the state itself. So just a suggestion. And then last, another suggestion. California has done some really groundbreaking work on basically how do you help an addict that doesn't want to get help. And Governor Newsom passed into law some important legislation back in November, so they probably have some initial results on that. And that might be helpful for you to look at again, because we need to address this issue. In fact, I have a letter from one of my constituents who's a retired mental health nurse who has a grandson who's really got a lot of problems but does not want the help. And I'll share that with too, and I'll share it with all the other council members too, because it's very touching and just opens up the door to what do you do to help people that are not seeking help. So thank you.
Thank you.
Great. No one else is on queue. So thank you, Commissioner, Deputy Commissioner, for the comprehensive presentation. We really appreciate it. Our clerks noted many questions, so we'll just wait for those follow-ups. I believe Vice Chair Wansley is going to clarify or follow up with the specific questions she had. But I appreciate you both being here and for giving us this comprehensive presentation.
Thank you, Chair Chavez, council members.
Appreciate it. Okay, our next and final item is receiving and filing a presentation from the Unity Community Mediation Team. Since this is my item, I will introduce it briefly. We will be hearing about their efforts regarding community-based police conduct complaint sites. I'd like to welcome them here to present their presentation. So as you walk up, just please present who you are and your name, just so the public knows. Thank you. And we have a video too.
Good day, Chair Chavez, and to council members. We represent the Unity Community Mediation Team, and my name is Ian D. Bethel, and I serve as the chair of the Unity Community Mediation Team, and also co-chair of the Police Community Relations Council, along with Chief Brian O'Hare. And I would like to just initially report to you concerning the MOU that was signed between the Unity Mediation Team and the Mayor's Police Department in the City of Minneapolis, that at our Police Community Relations Council meeting on just this week, in terms of compliance with that MOU, we are now at about 50%. As of the end of last year, we were at about 25%. And then again, our touchstone regarding police and community relations is grounded on reform, transformation, accountability, and consequences. And not just for Minneapolis Police Department, but also on behalf of the community as well. And so we're here today in the spirit of our accountability regarding compliance with the MOU. The successful compliance of the MOU really lies with the relationship that we have established with the Police Community Relations Council. And so today we do have members of the Police Community Relations Council who are with us, and members of our Unity Community Mediation Team. Today we're going to have our Young People's Task Force to come and to make the presentation to you. When we signed the memorandum of agreement some years ago, and now we have revamped that to the MOU, one item that was really missing was young people. And so we immediately established a Young People's Task Force. And so I am just elated and grateful to have the Young People's Task Force to come before you today with this presentation on behalf of the Unity Community Mediation Team and the PCRC. Miles Wilson, who is the treasurer of the Unity Community Mediation Team and chair of the Young People's Task Force, and also A.J. Flowers, who is a board member of the Unity Community Mediation Team and a project coordinator of the Young People's Task Force, and Rachel Dion Thunder, who's a board member of the Unity Community Mediation Team, and she's co-founder of the Indigenous Protector Movement. And again, Chair and Council, thank you for having us today.
Good afternoon. My name is Miles Wilson, and I am the treasurer of the Unity Community Mediation Team, as well as the chair of the Young People's Task Force. And right away, we put on a presentation. We created a video that we would like to present to you this afternoon, and so I'll just jump right into that right now.
Thanks, Miles.
The Unity Community Mediation Team, or UCMT, founded in 2003, is a group of diverse community leaders and organizations working for the transformation of public safety in Minneapolis. Our work has been led by the late Ron Edwards and Clyde Belcourt, as well as Spike Moss, Pastor Mary Flowers Spratt, Bill Means, Pastor Ian Bethel, and others. We work with partners in all communities, including African American descendants of the enslaved, Native American, Somali, Latino, LGBTQ, faith communities, and others. On December 4th, 2003, the UCMT signed a Memorandum of Agreement, an MOA, with the City of Minneapolis, a 24-page document drafted with the help of the Department of Justice. The MOA outlined action items dedicated to changing the culture of policing and protecting the safety, human rights, civil rights, and legal rights of all Minneapolis residents. This MOA contained over 100 action items brought to the table by UCMT to address excessive force, improve police-community relationships, respond to the mental health needs of the community and officers, child protection, and diversify the MPD. The UCMT work continued for 5 years in collaboration with the community members and organizations to bring MPD into compliance with the agreement. The City of Minneapolis ended the MOA in 2008. On May 25th, 2020, George Floyd was tragically murdered. That's when UCMT members moved quickly, the next day in fact, to revive the mediation process. During the summer of 2020, MPD and UCMT were brought together once more with the Department of Justice, and this time with Chief Arredondo. In 2021, while some were calling for defunding and dismantling the police, UCMT called for both police and transformation. We need police officers to be held accountable and a complete community-led transformation of public safety in Minneapolis. The UCMT worked with MPD, this time without a mediator, to update and expand the original MOA to a new Memorandum of Understanding, MOU, that was signed on August 8, 2022. In November 2022, UCMT held the first annual Report Back to the Community event at Sabathani, a potluck with hundreds of people that came together to celebrate the signing of the MOU and this new relationship being forged between MPD and the Minneapolis communities. The next year, UCMT held the second annual Report Back to the Community, where it was announced that MPD and UCMT were in compliance with over 25% of the action items in the MOU, representing real progress in only 1 year. The commissioner of the Minnesota Department of Human Rights frequently attended UCMT meetings as she prepared to file suit against the city of Minneapolis for years of abuse of African Americans and Native Americans by MPD officers. The settlement agreement to this suit closely tracked with the action items in the MOU that had been signed by MPD and UCMT a year earlier. After the Department of Human Rights settled the suit, the city agreed to a settlement agreement to be overseen by a judge. UCMT is working closely with the monitor of this process, Effective Law Enforcement for All, ELIFA, and ensuring they listen to the voices of Minneapolis residents. In 2024, the UCMT initiated new public safety infrastructure based on the MOU to create 9 community-based sites with trusted community agencies in the African American, Native American, Somali, Latino, and LGBTQ communities. These accessible sites specialize in the following: a safe, culturally beneficial location to intake police misconduct complaints, a first stop mediation between community members and MPD, mentorship for new officers by pairing them with community members, and to serve as a liaison, keeping neighbors informed about public safety issues. A highlighted program includes our Community Mentor Program, also called for in the MOU, where newly hired MPD officers are paired with the site team members to ensure new officers have good relationships with our communities. The MOU is a living document that will continue to guide public safety in Minneapolis. The work happening now in the community and in City Hall can serve as a model for other cities. The Sites and Mentor Program are just the first promising steps UCMT is taking in the transformation and accountability of public safety in Minneapolis. We request your support for the UCMT sites. We request $937,900 each year in support of the 9 sites for the next 2 years. Thank you.
Thanks for the video, Miles.
Thank you. Just before I pass the microphone off to my next presenters, I just want to make a statement that the sites that we mentioned on the video, we have 8 of those sites, and these sites are now open and accessible to the community, which the first one is the UCMT headquarters at 4301 First Avenue South, the NAACP Minneapolis, which is located at 1101 West Broadway, the Indigenous Protectors Movement, which is located at 1113 East Franklin Avenue, the Little Earths Residents Association, which is located at 2495 18th Avenue South, New Salem Baptist Church, which is at 2507 Bryant Avenue North, the Voice of East African Women, which you would have to call for an appointment with the telephone number listed at 612-707-1202. And then we have 2 more sites that are open. I might butcher this, but Nuestra Lucha, which is, again, call for appointment at 612-868-3532. And then Quorum, which is also call for appointment at 612-384-1355.
Thank you. I'm A.J. Flowers. Thank you, Council Chair Chavez and Vice Chair Wansley and all the rest of the committee for here today. We are here today to talk about the power. I'm sorry, it's not getting my voice. Okay. We're here to talk about the power of community, the power of transparency, and the power of mediation. As we spoke on in 2020, we all were here with tough decisions to make. And I know everybody had different sides of the aisles that they thought they would be on or whatever. I'm not here for that. We're here for the simple fact because we found out a solution, a community-based solution where we can bring the power back in the hands of the community. We're community members from diverse backgrounds, all diverse backgrounds, who have different experience with law enforcement and have different views of what law enforcement is to them, can have a seat at the table, and that they were able to speak and come up with this memorandum of understanding so that we as a community can get back to transparency, so that we as a community can have the power back into our hands. With that, we were able to come up with a lot of great actions within our MOU. One of the actions that we're talking about here today is our community-based police conduct and information sites. We are fully committed to UCMT to the transformation of public safety in Minneapolis through the full implementation of the Memorandum of Understanding with Minneapolis Police Department in the city of Minneapolis. And Section 7.24 of the MOU pledges UCMT will make police complaint form available at community sites. UCMT is working directly with the Minneapolis Department of Civil Rights and the Office of Police Conduct Review, which is a branch of the Civil Rights Department, to make each community site an official intake site in the City of Minneapolis Police Conduct, make each community site an official intake site of the City of Minneapolis Police Conduct complaint process. The overall organizational goals and objectives are to partner with trusted community organizations to provide a safe and comfortable place for community members to get information about the public safety transformation underway in Minneapolis, to work with community members who seek assistance filling out complaint forms at one of the community sites so they do not have to do so at a police precinct or a city hall, to work with OPCR to train staff at each community sites in the official Minneapolis Police Conduct complaint process, to build bridges and relationship between all diverse Minneapolis communities and the police department, and also to mentor new officers during their MPD Academy training and their field training officers training period, and be available as a mentor to the officer after they become sworn officer of the MPD. The ultimate goal of the UCMT community sites is to strive for a complete realization of its goals and objective of the Memorandum of Understanding, with emphasis on bringing in and working closely with our city youth and mentorship opportunities as our future city and civic leaders. As I said before, with this process right here of having a community-based site, you give your community an opportunity to come into those sites where they feel comfortable. As we said, with having different diverse communities of our Somali, our Latino, our LGBTQI, we do understand that a lot of people are not comfortable going into certain places. People are comfortable with people that look like them. So what we have in this whole process is that you can come into these complaint sites where you can file your complaint. And what can happen is the mediation process starts immediately. So once that complaint is to us, our first job is to reach out to said law enforcement, depending on which precinct they're at, so that we can first see if there's a mediation process there. As you can see in the packages that we all gave you, in the bottom page, it shows some of the examples of cases that we have already had where complaints have not been filed because we were able to mediate and have both families and law enforcement feel satisfied with what they got coming out of those mediation process. The power of this is conflict resolution. We ask for community-based solutions. We feel as though that this is one of the best community-based solutions that we can have that works on behalf of all communities and also in conjunction with law enforcement and the Minneapolis Police Union as well, who's on board with this as well. So I just ask for you guys to hear us, and the next person I'll be introducing is Rachel, who will give you a little more understanding of some of the work that's already being done in some of these sites right now. Thank you.
Thanks, AJ. Welcome, Rachel.
Tanse, Gananaskamotan and Anaskamotan Upsis Nanahiawak Upsis Rachel Dion Thunder. Hello. Greetings to the members of the Minneapolis City Council Public Health and Safety Committee. My name is Rachel Dion Thunder. I am Plains Cree First Nations, Treaty 8, resident of South Minneapolis, co-founder and VP of Operations of the Indigenous Protector Movement. I stand before you today as a representative and team member of the Unity Community Mediation Team, or the UCMT, to speak on the crucial work that we have been doing to transform public safety in our city from the community level. Our efforts are rooted in a commitment to fostering a safer and more diverse community where trust between the public and law enforcement is not just a goal, but eventually a lived reality. My goal here today is to share with you the work we have been doing and the path that our work has an opportunity to take, making our goals a reality and giving you an opportunity to support this community-driven solution. We are proud to report, as many of the previous presenters have mentioned, that we have achieved a compliance on over 25% of the action items outlined in the Memorandum of Understanding between the UCMT and the Minneapolis Police Department. These achievements include significant progress in key areas including use of force, MPD community relations, accountability of police officers and transparency into investigations, diversifying the workforce, cultural awareness and sensitivity training, and behavioral health response and officer wellness. These accomplishments demonstrate our dedication to real, tangible change in the way that public safety is approached in Minneapolis and potentially across the nation. However, they also highlight the ongoing need for continued effort and support to fully realize the transformative vision laid out in the MOU and the years that that work will take to be done. As we look at the progress made, it is essential to acknowledge the substantial and ongoing work that the UCMT has been undertaking. Our mission has been clear: to create a bridge between the community and law enforcement, fostering a partnership built on trust, accountability, and mutual respect. This work is not just about addressing the immediate concerns of public safety, but also about laying the groundwork for long-term community building and systemic change, and thinking about not just this generation, but in my teaching, 7 generations ahead. The need for our work has never been more evident. Minneapolis, like many cities across the nation, has faced significant challenges in relationship between law enforcement and the community. The tragic events that have occurred here have highlighted the deep mistrust and systemic issues that must be addressed. And more recently, these issues were revealed in the Department of Justice's report here in Minneapolis, showing the injustices that our people, as Indigenous people, as Black people, as people of color, continue to face even in recent years post-George Floyd. Our work is a direct response to this need, a need for a new approach to public safety, one that prioritizes community voices and holds law enforcement accountable through community action. UCMT has experienced significant growth over the past few years. What began as a small initiative has now expanded to include the 8 sites, the 8 community-based police conduct, complaint, and information sites across the city. I can speak to the amount of workload at our site at the Indigenous Protector Movement and the rate of growth this work has taken. The numerous families and actions and issues that have been brought to us, and not only brought to us, but working with MP to find solutions that actually satisfied both sides. Each site is more than just a physical location. It's a symbol of the community's commitment to justice and accountability. At each site, our growth has been reflected in the relationships that we have built. We have forged strong partnerships with neighborhood organizations, local leaders, community stakeholders, and electeds. These relationships are the backbone of our work, enabling us to create a network of support that extends for beyond the walls of our sites. Together, we are building a stronger and more resilient community, one that is empowered to advocate for its own safety and well-being. Within the police department, our collaboration has been equally crucial. We have worked together on cadet mentoring training initiatives that address the concerns and needs of the community, while also ensuring that officers are better equipped to serve all residents with the respect and understanding that they deserve at the community level. This has been an ongoing process requiring commitment from both sides to engage in a new dialogue, one that prioritizes accountability and transparency. The MOU between the UCMT and MPD is a living document, a testament, one that is generational in its scope and significance. It establishes a strong police-community relations council designed to monitor and implement the MOU's provision. And this council is a vital mechanism to ensure that the commitments made are not just words on paper, but actions that lead to real change. And these sites are that real change and that real action in community. It is imperative that we hold our systems accountable and that we elevate our community voices. Today, we are here to request your continued support for the UCMT's initiatives. Specifically, we seek your endorsement and financial backing for the community-based police conduct, complaint, and information sites. Over the past year, we have worked tirelessly with 8 sites already established and functioning, each serving as a beacon of hope and justice in their respective neighborhoods. To sustain and expand this vital work, we require $937,900 annually for the next 2 years. The budget request we present today is essential to expand and sustain the vital work currently already being done by volunteers and by people out of the extra hours of their day who have generously given countless hours to make our initiatives possible. The proposed budget would fund a full-time position to oversee all of the responsibilities of the MOU and the police complaint sites. It would also fund a part-time position to lead into community relations, and so that these resources and sites are fully accessible and known to community. And it would also help maintain the integrity of our programs. The physical office spaces are equally important, providing a dedicated, accessible location where community members can seek assistance, file complaints, and engage in transformative work that we are doing. While volunteers have laid a strong foundation, the workload has become too extensive to be sustained on volunteer effort alone. Full-time staff and proper office spaces are necessary to ensure that these sites can continue to serve the community effectively and meet the growing demand for their services. This investment is not just in a program, but into the future of Minneapolis, a future where public safety is defined by community collaboration, mutual respect, and a shared commitment to justice. I want to thank you for your time and listening to all of our presenters today, and open it up for questions at this time. Thank you.
Thank you so much for the presentation, everyone. I think one thing that's really stood out here is how we can build trust with people that are filing police misconduct cases, and you can't always feel comfortable doing it at a particular police station, but if you are able to do it with the community members that you trust, people that look like you, you're more likely to file one of these cases, right? I think one thing I often hear from at least people from the Latino community is the mistrust that we sometimes have with law enforcement, and how scary it can be when calling 911 or when you're interacting with a police officer because of immigration status, you name it. And I see these sites as a way to help build that trust, to help maybe if it's one more person being able to actually file a police misconduct case, that is a good thing, right? So I just want to thank you for the presentation. Let you all know that council is going to be deliberating the mayor's budget beginning November. We'll adopt the budget in December, so I just asked that my colleagues keep these presentation in mind as we head into the deliberating the recommended budget. So thank you so much. I'll pass it on to Councilmember Palmisano.
Thank you, Mr. Chair. In that vein, I noticed in preparing for committee today that in the LIMS file, it has a $523,000 budget ask, but what I saw in your presentation was about double that. So I'm just curious how that amount of money, or request for money rather, is increased over time. Like, what else is it funding, or have the costs just gone up?
Correct. So I think that original budget did not properly value the worth and time that it would take to properly do this work and deliver these services to community in the way that the community deserves. And so that original budget did not reflect the 8 full-time positions, having a full-time position at each of the 8 sites, and it did not reflect a part-time position, and it also did not reflect the office lease space. And so I don't know why that hasn't been updated, but we do have an updated budget. Be happy to provide that to you, and it has all the line items broken down with descriptors.
Thank you. I just hope that after this meeting for the public that we get that changed in the piece. Thanks.
Yep, so it should be reflected already. It's on the updated presentation. So there's 2 presentations on LIMS. There was a draft one, and then so it is already reflected if the public wants to see it, just as updated as of, I believe, yesterday. So those changes should already be reflected. And then next up, we have Vice Chair Wansley.
Thank you, Chair Chavez. Thank you all for presenting today. I did want to know if you could share some figures around how many complaints have been submitted thus far, and on average, across all 8 sites, how many have they seen come in year to date?
Okay, so I can speak specifically on our site that we manage, the Indigenous Protector Movement, and then we can have maybe some of the other team members come up and talk about like the entire 8 sites as a whole. For us at the Indigenous Protector Movement, We have seen on average one complaint filed at least about every 2 weeks. And what we have been able to do, because this is something that Jason just spoke on, is like us as Indigenous people, have like an extreme mistrust in police departments and in the system that be. And so a lot of our community members would not ever file a complaint report. They would not go down to City Hall to file a complaint. They felt that it was useless. And so now we see these community members coming in and filling out the complaint process, and where we are able to, as an organization, to use our address instead of them having to use their address, right? And so they feel like they have that extra layer of protection. Or we can use our name as the Indigenous Protector Movement instead of them having to put their name on the complaint. And so these are just details that we're able to do to pull in more community. We've also started a advertising campaign of these services. So like locations in our Native community, Indigenous community that we know community members are frequently, we have flyers, we have digital advertising on TVs of these services that are available. And so also outside of known filed complaints, we also have families coming in now that are asking to work with the site as a liaison. So that was one of the other responsibilities of the site. And so that was something that we didn't foresee taking up a big chunk of our time, but it has taken up a huge chunk of our organizational time of working as a liaison between families who might have a relative who is an active MMIR, or missing murdered Indigenous relative, right? Like someone who is missing, someone who has lost their life, and maybe they feel like intimidated to reach out to Minneapolis Police Department or to the city, or maybe they don't understand the process of doing that. We help them do that. We walk through it with them. We go to these meetings with them. And so that's a substantial amount of time that's also going to that work through these satellite offices. And that's for us specifically. I think that some similar work is happening at these other sites, so I'll let them talk on that as well.
We have a good example in your handout. I think we have about 1, 2, 3, 4, 5, 6, 7 examples. What's unique with our sites is that we've been able to resolve the issues because of our relationship with the Minneapolis Police Department. We take families, or we take individuals, we bring them right here to City Hall so that the families can fully view the full footage on those cameras. And from us having that type of access and that relationship with the PCRC, we have been able to mediate so that there are no complaints filed. And so we have about 7 or so examples. For instance, just recently, when the young man ran into the Minneapolis police car as the police car was turning, it was a mistake. But the word out on the street was that the Minneapolis Police Department brutalized this man. And the word out on the street was that there was going to be unrest. And so we were able to get the family, we were able to get Gators to come together, and we said, show this family the entire cam, and it was not a good sight. But there we saw, and the family saw, how the Minneapolis Police Department officers, with care and compassion, stood with this young man, aided this young man until this young man was taken to the hospital and even had that cam. And that was able to aid not only that family, but that was also able to aid this city. And frankly, it saved this city a lot of money. Because if a complaint, and if it was found that this complaint, even though it was wrong, if it would just got out on the media, this city would be up. once again. And we have several other complaints that have come in that was proven to be handled through mediation, and so there was no complaints. And Councilmember Wansley and to the Chair Chavez, when the OPCRC leadership fell apart earlier this year, at that point, all of our site leaders and site teams had a whole day's training about how to fill out the forms, and all the forms were conducive to each site, even in different languages. But when the top leadership was fired and also resigned, there were some hiccups that happened. And all of those, and so all of those forms, et cetera, and all the new training that was promised to us by April hasn't happened. But as of last week, we met with the city attorneys and Amelia, and we're now in the process of going to be retrained and making sure that all of the proper forms are updated and are in each site. And so I just wanted to make that point about how the relationship between the sites and the Minneapolis Police Department, how far that has come, where we've been able to quelch unnecessary rumors and unrest in the city through mediation.
Thank you for that overview. I do have a follow-up clarifying question because the budget request seems to be for the sites to solicit complaints. It sounds like you've shared that your outcomes has been mostly mediation that has not led to complaints.
Yeah.
So it's unclear what we will be funding at these sites if they're not receiving complaints, or if you're asking for funding just for mediation-based work?
No. Okay, come. Yeah.
So I believe that in some of the supplementary material, there should be 5 main responsibilities of these sites. One is the helping community members file complaint process, that they don't have to come to City Hall or to the entity. But then there's also mediation, liaison, the mentoring responsibilities of how we were talking about, like with working with MPD cadets to connect them with community and culture. So it's those 5 main responsibilities for the sites. It's not just the complaint process.
And I believe, Chair Chavez, we don't have those supplemental materials, so I think that's causing some confusion here. And in terms of being able to see, again, like what specific outcomes, like how many hours are you doing around mentoring young people that you're serving through that. So I think Chair Chavez is working to send that out to all of us.
Yes.
So that we can get that. And then I did want to see too, because some of these sites are appointment based. So I did want to see if there's been any updates. I'm seeing the presentation. We have the slides.
Mm-hmm.
The NAACP Minneapolis site, it still has Londell French as the contact, but from my understanding, Londell French had resigned from the NAACP when he took or was running for state office. So do you have a different contact for this particular site?
Yeah.
Adrian.
Yes, the particular contact we have right now is Hassan. His name is Hassan, but we also working directly with the NAACP president, Cynthia Wilson, as well, to have a representative. So she's been the person that we've been contacting directly. And also, just to double back to one of the questions you asked, I think it's important that while these community-based sites is for police complaints, the mediation parts come from the family as well. So a lot of times, because we have had this lack of trust over time, it might be a family that comes in that's hearing one thing, And then by us being able to go take them there, they don't want to file the complaint no more. We still leave the option open, but sometimes the situation get resolved. But having that level of transparency helps. So right now, the person that's in contact will be Cynthia Wilson, and the younger person is Hassan. I can't pronounce his last name, so I don't want to mess it up. But his name is Hassan. He's with the NAACP.
Thank you. And we got the packets. If you have any information based off of, it sounds like the different programmatic pieces you laid out that the sites do, of like, again, how many families are participating, kind of your tracking processes of
Right.
complaints, and how that's relayed to either civil rights or OPCR. I think we're on the body are making sure, like, when we're funding things, there are those trackable pieces to avoid any potential litigation or anything. So if you have that information, that would be helpful.
Yeah.
As now we have this packet.
Absolutely.
Yeah.
Okay,
Thanks.
thank you.
Next up, we have Councilmember Rainville.
Thank you, Chair. I know we're pressed for time here, so I'll be very brief. Thank you so much for this very thorough presentation. Pastor, your team is great. I've gotten a chance to know many of you. You're doing fantastic work, and your timing is impeccable to come to us before our budget. So there's a lot to absorb and digest, but to all of you in the audience, thank you so much for your time. You've really taken non-armed public safety to a higher level. Thank you, Pastor.
Councilmember Palmisano.
Thank you. I'll be brief as well. I did want to mention that the LIMS file, the public file, has been updated, but it must have been sometime today because I was looking at it this morning, per your earlier comments. Reverend Bethel and team, thank you so much for being here. I want to point out my support for connections into the complaint process. Early in my tenure, I was part of a subcommittee, a public-facing committee on how to better provide that kind of community support deep into the community, and this is certainly one of those ways. And I know police leadership is here with you in the room because they agree, and that's important. You know, I do know in part firsthand how many people have fear in coming into not just a police precinct, but frankly into any government building. And so all of the things you said, Ms. Thunder, really resonate with me. So thank you. Thanks for the presentation.
Thank you, and thank you all so much for the presentation. Seeing no further questions, one, thank you all for staying a little bit over. I know we were supposed to get out of here at 3:30, but we're done. So seeing no further questions, I will direct the clerk to receive and file that report. And seeing no business before us, I will declare this meeting adjourned. Thank you.
Thank you. And thank you for all the work that you guys do, too. I know it's not easy, even though we give you hell sometimes.